Drastic changes and more money, the medicine prescribed by NHS bosses to preserve the health service. The new head of NHS England wants GPs and hospitals to operate differently and says people should take more responsibility for their health.
A comprehensive, tax-funded national health service of the sort that the nation clearly wants remains entirely doable, even despite the difficult economic circumstances that continue to face this country.
We worked out that we could change what the front end of primary care looked like in terms of people accessing us digitally. We could change the back end in terms of bigger scale. And then also we could develop into things like community care so that some of the specialised services that traditionally were delivered in hospitals would be better delivered closer to the patient in our GP practices. The fact that they can get hold of us relatively easily by phone means that particularly parents with young children feel much more confident in their GP practice.
Before the new system, we had to go down there and sit in the surgery, and it was full of people coughing and spluttering and kids crying and screaming. But it's so much easier now.
I am optimistic that if we do get the resource and the commitment to general practice, that we will see things start to turn round.
The 5-year forward view really sets out how patients should be at the centre of health service design. This place has been designed by patients. The cafe works because it provides a calm and supportive place for people who are having mental health problems to come and receive support from a health expert, plus mutual support from each other.
Finding this place helped me to have hope.
If this place wasn't here, then I probably wouldn't be around at all, I don't think.
The evidence that the cafe works is based on a recognised reduction in A&E attendance for mental health crisis and a 33% reduction in acute hospital admission for mental health crisis. That equates to a cost saving of £500,000 a year. The data just shows how effective it is.
A health promoting school is one that views their students in a very holistic way. We recognise that students have got all kinds of needs, not just physical, but really around their emotional health and well-being, because we know that that affects their attainment and their success whilst they're here.
I've seen all the trends from the days gone old in the old high schools where it was chips and burgers and Coca-Cola. So I've seen over the years how it's changed, and it's good. We hide vegetables in cakes, we do chocolate and beetroot, we do courgette ones, everybody's happy, we make wraps, we put salads in the wraps, and that way it's gradually introduced into their diet.
The 5-year forward view really sets out a framework by which we can tackle prevention of type 2 diabetes, but also providing the sort of support and education to allow those with diabetes to be able to manage the condition really well.
For knee replacement, we found the same implant of a knee in one trust of £1,000, and in another trust it was £1,800, and that trust was doing the highest volume. And what's been very interesting around the country is that every hospital I've been to, they all think they're getting the best deal, and they've told me they're getting the best deal, and they clearly aren't. So, huge amount of variation. If we sort out, we could easily save, I think, that just in orthopaedics alone across the NHS, £2 billion over 5 years, and I think that's a conservative estimate.